Hello guys, this is Semana Doc with me, Henry.
And Gladys.
Welcome to this series where we are continuing to talk about sexually transmitted infections. Today we have a very interesting topic about syphilis.
So syphilis is a sexually transmitted disease that is caused by a bacteria called Treponema pallidum, or just rather T. pallidum. It is transmitted via oral, vaginal, or anal sex. Yeah, and it's also transmitted from mother to child during pregnancy.
So, what are some of the risk factors that will put you at an advanced risk of developing this infection? And so the first one is actually multiple or new sexual partners. If you are engaging in sex with more than one partners, or you have a new partner, you are at a higher risk.
Another risk factor is having unprotected sexual intercourse.
Yes.
At any time you have unprotected sexual intercourse, probably because of any kind of inconveniences, then you are actually at a risk of getting not only syphilis but even other sexually transmitted diseases.
Yes.
Yeah.
Gays and bisexual sex partners are at an advanced risk of getting of this infection. Another risk factor is actually an immunosuppressed state. Anyone who has their immunity low, such as people who have HIV, people who have diabetes, cancers, basically people whose immunity cannot easily fight the infection off, so it can actually get seeded and develop in them. Yeah.
Another risk factor would be sharing of sex toys. So this is, I guess it is self-explanatory. If you have to use someone else's sex toys, then you're actually at an increased risk of getting whatever that other person has.
Yes. Yeah. If you are engaging in unsafe practices of sex, such as not observing hygiene and having unprotected sex anyhowly, you are at a higher risk of getting the infection. Yeah.
So we are going to be talking next about the signs and symptoms that you would have if you had syphilis.
Yes.
And before we talk about that, we just want you to know briefly that syphilis occurs in stages.
Yes.
We have primary syphilis, we have secondary syphilis, we have a period in between secondary syphilis and the next stage, which is called tertiary syphilis, that is called the latent phase. So primary syphilis presents with a painless sore that is called a chancre. This chancre will normally occur at the primary site of contact. It can occur at the penile shaft, at the vulva, even around the mouth, or anywhere around the torso. Yeah, and this ulcer is normally painless, and it even goes away without treatment. So someone can assume that they got healed and will not even seek treatment for the same.
Exactly.
Yeah.
And secondary syphilis actually is the second stage. It presents, or rather you will have some systemic signs. Most importantly is a rash that develops on the palms and the soles of the foot, and of course on the torso. It can also affect the back, and this ulcer, or rather this rash, is characteristically reddish brown. It's rough and most importantly non-itchy. Secondary infection also presents with other symptoms of systemic disease, such as fevers, fatigue. You can even develop lymph nodes that are swollen. Yeah, all these are symptoms that you have gone into the secondary phase of the disease.
Yeah, and we say that the secondary stage can last up to from 3 months to 6 months.
Yes.
And this actually also goes away untreated.
Yes.
And someone can now go can then now go into the latent phase, where that disease can stay in your body for up to 3 decades, and then comes the tertiary syphilis.
Yes.
Yeah.
The tertiary syphilis, actually a multi-organ disease. It can affect literally almost every part of your body, including the brain, whereby someone develops neurosyphilis. It can also affect the ears, the eyes, and basically, and even the skin, whereby someone develops some cutaneous or other skin lesions called gumas, which are actually deforming in nature.
And so, how does someone prevent syphilis?
Yes, it's safe sexual practices.
Another way to prevent syphilis is not sharing sex toys. Sex toys belong to one person, and as such should be used by the same person only.
Exactly. We also have an issue to do with testing. We say that testing is very important, is a very important aspect or in terms of prevention of sexually transmitted infections. The first place, ensure that if you have a new partner, get tested before you start engaging.
Also, testing has to be done for every pregnant mother.
Yes.
All the pregnant mother in the first antenatal visit, when you go to your first clinic visit, then you have to be tested for syphilis.
Still on testing, the general public should generally be tested every other year. So that is yearly. And in the event that someone has multiple sexual partners, they should be tested more regularly. We are talking about between 3 to 6 months. They should be tested with at those intervals.
And therefore, talking about treatment, then treatment has to be initiated as soon as the blood tests come back positive.
Exactly.
Right? So normally treat with the conventional antibiotics that are used are penicillins. And so the doctor can prescribe to you other medications depending to the symptoms.
Let me also challenge you. You have heard of supergonorrhea, and due to the unlimited access to antibiotics, researchers have said that it's easy for us to develop something like super syphilis because of the continuous abuse of antibiotics all along. And so we should be careful when we are using antibiotics. If you have ever had syphilis before, years later you can easily test positive for syphilis. This does not mean that you have it, but the test remains positive for some time, but you have already achieved the eradication of this bacteria.
We have come to the end of our video. Thank you so much for staying with us till the end. For those who have not subscribed, please make sure you subscribe to our video. Please make sure you also comment, like our video, and make sure you hit that notification bell so that you can be notified every time we upload a new video.
Exactly.
Thank you so much for staying with us. We love you.
We love you.